أهلا بكم مشاهدينا من جديد. معنا اليوم الفائز بجائزة حمدان للشخصيات الطبية المتميزة في المجال الطبي بدولة الإمارات العربية المتحدة، الاستشاري في أمراض القلب الدكتور عزان بن بريك. ابقوا معنا. دكتور عزان، ما هي الإنجازات التي أهلتك للفوز بالجائزة؟
We have started doing research in Rashid Hospital since 1996, and our first research was on patients with heart attacks, giving them what we call clot busters. This was a multinational. It wasn't just in Dubai alone, it was many other countries, United States of America, Europe, and we were part of this trial. The idea of why we should participate in this, because different populations behave differently with medications. And therefore we wanted to find out how do our population in the United Arab Emirates behave with this new product. At that time it was very new. We didn't know how they would react. Fortunately, they responded extremely well with this medication. And that was the beginning of really big research. And this was published in a prestigious New England medical journal, well-known journal in the world. And that put our name in the international map of cardiology. And after that we started with Ascent 1 and then 2, 3 and 4. There were different kinds of... In Ascent 2, we were actually audited by FDA from America. One of the representatives of America came to Dubai, looked into our data to make sure that the research was done really quite well. And we were very pleased that we passed that. They gave us a pass for this. And with that, it opened up really big studies. Then we started doing many other research which are published in very good journals. One of the latest ones that we are really proud ourselves is that we did a meta-analysis in looking at the patients with heart attack and in giving them what we call this thrombolytic or clot buster. And we found that our mortality, our death, was extremely low, very low compared with the rest of the world. Part of the reason is that many of our patients are young people, and young people do very well. So that was very good, and it gave us an idea how to deal with this kind of patients.
دكتور عزان، الدور الذي تلعبه الجائزة في خدمة القطاع الصحي، ما هو الدور الذي تلعبه على مستوى العالم أو على مستوى دولة الإمارات العربية؟
Wallahi, research is extremely important because it tells us whether the medicines work or they don't work. Yeah. All right. Secondly, whether these medicines cause any problems with our population. Remember, we are all human beings and we behave in the same way. But we have learned that different populations react differently with some medicines. For example, in patients who are Afro-Americans in America, they respond very well with the drug for blood pressure. Patients in Southeast Asia, in Japan and China, for example, there's a medicine called ACE inhibitors. In this population, up to 35% of that population, they have cough, whereas the rest of the world is only 5%. So it's extremely important to know our population, how they behave. The other thing that we have done, for example, there was the study that we have done, we just looked at the UAE population, they're called on target. We chose the UAE population because it was a long study, 5 years we have to follow these people, and therefore we had to use population which was stable, that they will remain here. If we use non-local, they will be here for 2 or 3 years, and it's very difficult to do follow-up. So we've chosen. And we found, for example, in this tablet which causes cough, in our population, it's very low incidence. Very few people has cough like they do have in China. And so it's important not only to know that the drug works, but we also have to show that in our population that it works and it is safe.
دكتور عزان، ماذا تود القول حول جهود سمو الشيخ حمدان بن راشد آل مكتوم راعي الجائزة في رعاية العلم والعلماء؟
I think Sheikh Hamdan is doing an extremely, I can't overemphasize the encouragement of this kind of Jaiza. It's extremely, it encourages all of us that we get recognition of the work that we do, and therefore it encourages a lot of people to do research. And when you get somebody like Sheikh Hamdan who appreciates what you have done, that by itself is tremendous reward, really. When Sheikh Hamdan and his scientific committee say, we recognize the work you have done and we appreciate, that by itself is enough for all of us. So it encourages all young doctors and future generations, not only in UAE, but in the Gulf, in the Arab world, and the world as a whole.
دكتور عزان، هل هناك رسالة معينة تحب أن توجهها لأحد عبر تلفزيون بلسم؟
Yes, I think for any doctor, there are three parts, I think, in my opinion, is very important. Number one, and by far the most important thing, is our patients. That is the core business of a doctor. We must provide the best medical treatment to our patients. And therefore we must keep ourselves up to date to see what the rest of the world is doing, what are the guidelines, and therefore deliver that medicine. But that's not all. I think the most important thing is that we must deliver that medicine, the best medicine, with compassion and understanding. You know, we must be good to the patient so that the patient feels that we are not doctors, but we are friends. You know, that is number one, the most important thing. Number two, we who have experience, who have learned, we must impart that knowledge to our junior colleagues so that the good medicine continues. And the third thing is research, you know, and in that order: patient, education, and then research. These are the three important things.
دكتور عزان بن بريك، استشاري في أمراض القلب، شكرا جزيلا لك.
لا، شكرا.